Hello and welcome, my friends from Ayurveda. If you are an Ayurveda graduate, if you have passed out this year, last year, or if you are in early years of practice, today I am going to answer all your questions and all your queries regarding career after MPH. In our channel, I am getting lot of queries on my WhatsApp number regarding what are the options for Ayurveda graduates after they do MPH. And is there, especially the question is about, is there any discrimination by NGOs and government organizations whenever they are looking for public health positions when they get application from MBBS, BDS graduates and Ayurveda graduates? So stay on with this episode. Today I'm going to dispel all the myths, answer all the queries, and if you have still some questions, you can always ask your questions in the comment given below. So starting off the discussion, what's MPH to the newcomers to the channel? MPH is a master's level program. That is, you can do this after your graduation has been completed. So it's 2 years master's program of 4 semester. That means it is divided into 4 6-month semesters. The course took off like most of the modern courses from the source of United States and Europe, but now this is fairly old in India. Most of the AIMS have got this course, apart from other institutes like this, Goenka University and other prominent universities. Now talking about what promise or what skills this course offers. So this course offers you skill to become a public health leader. This is the first question. Hang on with me. I will explain what's required with public health professional. Then I will discuss about what's the fees for this program and what kind of salaries you can expect once you have done Ayurveda graduation and you join in MPH. So talking very briefly about this MPH program. MPH program is for people who want to take the leadership roles in government organizations. Suppose, take for example, government wants to eliminate malaria. Now it is working really hard in malaria elimination. So to do that, we need a doctor who takes care of complete implementation. That means ensuring that in every district there is a coordinated effort made, and even within the district, coordinated effort is being pushed forward. And for that, we need a special doctor who has got specialization in public health. So public health talks about these three things. One is promotion of good health. Number two is prevention of diseases. And number three is protection of individuals. To achieve these three, public health professionals are involved in research to find out which diseases are most prevalent, what are the individual number of affected people of diseases, like how many people are affected with malaria, how many people are affected with tuberculosis, HIV, dengue, chikungunya. Post that, MPH people are involved in policy making. That means how much fund to allocate, how many doctors to recruit, how many nurses to recruit, how many lab technicians to recruit, how many educators to recruit for every individual disease control and promotion. So after research, the second work is policy making. Now the third work is managerial role as program managers. So every district has got program managers for different program, like program manager for child health, program manager for maternal health, program manager for infectious diseases. So all the different, after research, after policy making, is program managers. And many government agencies are involved, but you will be surprised, many non-government agencies also are involved. So there is lot of requirement of fund. So to apply for the fund, You have grant writers who are again masters of public health professionals who have worked hard in this domain. So they apply for grant, get the grant, and when the grant is there, how the money is invested in different developmental projects, whether the work is going on the path or not. To evaluate all this, we have monitoring and evaluation individuals who are working very closely with program implementation, creating reports, creating data to be shared with the funding agencies. So we have got research role to understand the disease and its spread in the community. We have got policy making roles to make different policies to control diseases, to prevent diseases at individual district level. Then we have got program implementation officers, we have got grant writers, we have got monitoring and evaluation officers, then we have got public health communication professionals who design and create public health communication. That means creating right kind of slogans, creating right kind of messages for the community. And all this, mark my word, is done by Masters of Public Health Professionals. Here at our institute, that's why we involve students right from the first semester in community project, community research, screening projects, designing screening programs, analysis of data, creating policy frameworks, getting involved with seminars, visiting lectures from industry experts from public health policy making and NGOs, so that you get the hold of all the things right from the first semester. Then at the end of first semester, and you have got short-term projects. At the end of second semester, you have got 2 months internship that is designed by university itself. And at the end of third semester, you get a 6 month hand-holded program exposure where you are working on an actual project. And suppose you are from an Ayurveda background where you have already practiced in clinical setting, you understand the diseases well, you understand the diagnosis well. Now, if you are equipped with research tools, if you are equipped with communication skills, how to communicate in community, if you are understanding the research process, you are most valuable resource for research industry. You are most valuable resource for implementation. So imagine what kind of expectation market has from you. This course has got tremendous possibility in India in coming 15 to 20 years, because we are right now the youngest population, and as and when population starts aging, chronic diseases also are going to rise. To take care of such large population, we need millions of public health professionals, and you have to take the leadership role. Talking about fee structure, so the course varies. Like, we offer one of the highest quality program at 2 lakhs, around 2 lakhs program. Then best of industry exposure for you, and post the program, यानी कि program करने के बाद, you can expect a salary that is no less than 6 to 7 lakhs per annum to start with. And post 2 to 3 years of work experience, you can get a salary anywhere between 9 to 15 lakhs. So what are you waiting for? If you have any query, you can come to our WhatsApp contact number, or you can visit our website. You can also follow our Instagram link, which is provided below, to get more and more updates about our program and our activities. If you liked our video, you can also share with your friends. Yes, do not forget to subscribe and press the bell button so that you can get updated on all the new information and video that keeps coming. Yes, I'm really sorry, I forgot one question. So they talk about what positions are there for Ayurveda graduates after MPH. So you can become epidemiologist, you can become district vector-borne disease specialist, you can be senior researcher in a research agency. You can also get into training and academic positions. You can get into health training in private organization and health education in now different healthcare startups. You can get into development agencies like WHO, UNICEF, JPIGO, Global Fund. You can get into government agencies like National Vector Borne Disease Control Program. You can get into National Rural Health Mission. So all the different positions are open for you once you are Ayurveda professional and you choose to do MPH. So welcome all Ayurveda graduates to the Master of MPH program, a bright future, a bright and very strong career beckons you. It welcomes you to the field of public health. Welcome you all.